Welcome to the Houston Health Department's Health in All Policies Block Captain Training. My name is Demetta Landry, and I will be facilitating your training for today. First, let me give you an overview regarding lead poisoning. What is lead? Lead is a naturally occurring toxic metal that damages many tissues and enzymes in the body, which can be a harm to children starting even before birth. Lead poisoning is a major preventable environmental health problem in the United States. Impairment caused by lead exposure cannot be corrected. Children under the age of 6 years old and pregnant women are the most vulnerable populations. Children living in target zip codes in Texas should be screened at their 1-year and 2-year-old well child visits or before they turn 6 years of age. The action level of concern for blood lead levels is 5 micrograms per deciliter and above. However, per the CDC, there is no safe level of lead in the blood. Why should we care about lead poisoning? Children from low-income communities are 8 times more likely to suffer from lead poisoning compared to moderate and upper-income children. Children from communities of color are 5 times more likely to suffer lead poisoning than their white counterparts. What are the effects of lead poisoning? Potential health effects of lead poisoning include reduced IQ, learning disabilities, reduced attention spans, behavioral problems such as ADHD, anemia, impaired hearing, kidney damage, damage to the central nervous system, coma, convulsions, and even death. What are the early signs of lead poisoning? Symptoms may include headaches, fatigue, irritability, metallic taste in the mouth, an upset stomach, poor appetite, weight loss, stunted growth, and hearing problems. What are some sources of lead? The primary source of lead in a home is found in lead paint. Homes built prior to 1978 are considered at risk of containing lead-based paint. Other potential sources of lead in the home include ceramics, candle wicks, jewelry, candies, pipes, medicines, to include herbal remedies, batteries, and some cosmetics. Breathing in lead or eating lead can cause childhood lead poisoning. Small children enjoy playing with soil and objects that are easily accessible at their eye level. How is the Houston Health Department combating lead poisoning? The HHD hosts 2 federally funded programs with over 20 years of experience. The CDC-funded Houston Childhood Lead Poisoning Prevention Program provides surveillance, education, and awareness. The HUD-funded Lead-Based Paint Hazard Control Program, along with the supplemental Healthy Homes funding, provides home abatement. The Houston Health Department also provides free lead screenings to children and pregnant women through its Environmental Mobile Unit project and in partnership with select WIC programs. When children are tested, parents usually ask, "What if my child has lead poisoning?" If a child has been screened and found to have elevated blood levels, the HHD Child Lead Poisoning Prevention Program is informed by the child's medical provider, and the program case manager will then provide education to the family regarding lead and will share strategies for lead poisoning prevention. In more severe cases, the case manager will also refer the family for an environmental lead investigation, in which the Houston Health Department's Lead-Based Paint Hazard Control Program conducts a home inspection to see if the home contains lead-based paint or lead dust in and around the home. It is important that the child continues to go for regular lead screening as recommended by the child's medical provider until the blood lead levels drop below 5 micrograms per deciliter. In order to improve the health and well-being of our neighborhoods and to help educate our community residents, the Houston Health Department has begun the Block Captain Initiative. You may be wondering, why Acres Homes? Acres Homes is a high lead risk area. 74.8 of the homes were built in 1978 or prior, and 28.6 were built in 1950 or prior. Zip codes 77088 and 77091 were designated as targeted screening zip codes. In 2018, the 1-year-old screening rate averages to only 58%, and the 2-year-old screening rate averages to about 45.7%. In 2018, the elevated blood lead level rate for screened children under the age of 6 in these two zip codes was 0.91%. In 2018, 24.8% of the children were living below poverty. The program goals for the Block Captain Initiative are to 1. Increase community capacity and knowledge about childhood lead poisoning prevention strategies. 2. Increase rates of childhood lead screening. 3. Increase referrals to the lead-based paint hazard control program. 4. Improve access to resources and follow-up services. And the major overall goal is to provide lead-safe housing to residents, especially those households with children 5 years and younger. What is a block captain? A block captain is a community resident who is passionate about improving the health and well-being of their community. Block captains take responsibility for sections of their community, and they keep the neighborhood informed of health issues they may be facing, forming a system where neighbors are helping neighbors create a healthier community. For this initiative, a block captain's role is to help educate their neighbors about lead poisoning prevention and to help bridge the gap between the community and the health department, raising awareness among residents of available resources and services. As an overview, block captains will be provided with lead risk housing maps that allow them to conduct community block walks to identify potential homes for abatement. They will speak with residents to complete the lead abatement survey and then pass that along to the HHD program qualifier to determine eligibility. Identification and referrals. Once a block captain has attended a training, they can select or they can be assigned to an area of homes to survey. Block captains will speak with residents to complete a lead abatement survey for their selected or assigned area and make referrals to the HHD lead-based paint hazard control program. The lead abatement survey includes questions such as, does the home have a child 5 years of age or younger living or visiting? Or is there a pregnant woman in residence at the home? Does the home exhibit signs of peeling, flaking, or chipping paint? Has the home ever been remodeled? Once the surveys are completed, the surveys will be returned to the HHD Community Relations Specialist. The Community Relations Specialist will then meet with referred homeowners, renters, and/or landlords to explain the program and give complete details of the eligibility process. Recapping a block captain's roles and responsibilities. 1. Block captains receive training and are assigned a section of the neighborhood that they are responsible for. 2. Block captains are equipped with maps showing potential lead paint risks at the parcel level. Block captains organize community block walks, during which they utilize their training, risk maps, and intimate knowledge of their neighborhood to raise awareness and provide education to their neighbors about lead poisoning prevention, survey potential homes for referral by conducting visual assessments for lead paint, speaking with families to invite them to enter the city's lead abatement program, and documenting homes to refer for abatement. Lastly, the HHD will connect directly with the block captains who serve as the point of contact for neighborhood residents. This will allow them to receive potential referrals for lead paint abatement and to remain aware of additional challenges that the community may be facing. Let's now take a more in-depth look at the Houston Health Department's lead-based paint hazard control program. The Houston Health Department currently has two HUD-funded programs for lead paint remediation and healthy homes services. The first program covers the entire city of Houston, and the second program focuses on 4 high-impact neighborhoods shown to the left. Homes must meet certain criteria to qualify for the program, and if lead paint is found in the qualified home, these areas will be remediated. This will be done at no cost to the homeowner. Homeowners and renters can qualify for this program. What can our program provide? At no cost to renters or homeowners for families that qualify for the program, they can receive painting, vinyl siding installed, wooden windows or wooden doors will be replaced with new aluminum windows and new doors. It is very important that residents understand that this program is not a repair program. How can a home qualify? To qualify for this HUD federally funded program, a home must have a child or children who are 5 years of age and younger living or visiting the home, and or a pregnant woman in residence. It must be built before 1978. It must show signs of peeling, flaking, or chipping lead paint, and it must meet income eligibility guidelines. These are the main criteria, but other requirements may also apply. Let's look deeper at the key referral criteria. Homes must be built before 1978. Homes built before 1978 to the present will not have lead-based paint hazards. Lead-based paint was banned from being used on residential homes in 1978. At least one child 5 years of age and younger must live, visit, or be babysat at the home to qualify, or a pregnant woman must be living in the home. A visiting child is defined as a child age 5 and younger visiting at least 2 times a week for a minimum of 3 hours per visit, or visit for at least 60 hours total per year. Homes must show signs of peeling, flaking, or chipping lead paint. Homes must have wood siding and or wood windows. Homes with brick, aluminum, or vinyl siding and aluminum windows most likely will not have lead-based paint hazards. Homes cannot have roof or foundation damage. These damages must be repaired before the home can be considered for further eligibility. Here are some examples of peeling, flaking, chipping paint. Let's now look at several homes that have been remediated through our program. This is before. Take a special note of the areas in the boxes that have been highlighted. They show peeling, chipping, cracking paint. This is what you would be looking for when you're doing visual assessments of a home. And here is the home after remediation was completed. Here is a home before. Here is the home After. Even though this home is mainly brick, it has peeling, chipping, flaking paint on the upper areas. It also has wooden windows. Here is the home after. Before, after. This is another home before and after. This is a home before. Notice the wooden windows and after. Residents are able to choose the colors for their home remediation project. Before, after. Homes remediated through our program provides a healthier, safer environment for all family residents. And one last picture of before and after. Notice the difference in the two homes. If you have any questions about the material that was covered or wish additional information, please contact me by email or telephone. Thank you again, and I look forward to working with you in the Houston Health Department's Block Captain Initiative.